Now, I'm going to be talking about lumps in the armpits in women because this is something that women do tend to be concerned about. When you have a lump in the armpit, the first thing you're worried about is this breast cancer or is this some form of cancer? Now, lumps in the armpits can be formed for various reasons. It could be a boil, it could be a cyst, it could be a lipoma, it could be swollen lymph nodes, and as mentioned, could it be cancer? If you have a lump in the armpit, you might have a lump once and it never comes back again, or some women might have what we call recurring lumps where the lumps come and go. Or you might have a lump that has been there, no change in size, or you might have a lump that there was no change in size but it's now starting to get bigger and it's now starting to change. You might also have a lump that's painful, non-tender. Now the question is, how do I know if it's cancer? How do I know if it's a boil, cyst, or something else? Now, if we look at boil, a boil, as you know, is an infection. This is usually due to a blockage of the gland. A boil tends to be painful, tender, red, swollen when you press it, and it can be quite small as well. You know, as the gland is blocked, they can tend to get bigger, and they can be easily treated with, cold compresses, for example, or other treatments which I'll mention later. But the good news about boils is that they do tend to self-resolve. Okay, so if you see a boil that's red, swollen, tender, in some cases you might see what we call a yellow spot as well, which tells you that the boil is about to burst to release its contents. Now, similar to a boil, you might have what we call a cyst. A cyst usually has a pocket-like sac that might contain a jelly-like fluid. A cyst, again, is similar to a boil, but it's more deeper, while a boil is more superficial. Now, a cyst can be formed either because you've got blockage, again, of the hair follicle or the sebaceous gland. And in a lot of cases, a cyst does not resolve just like a boil would do. A cyst does not always self-release its contents. And some cysts can actually become infections and form abscesses where they become quite tender, painful and red, and you might notice maybe you get fever or night sweats. If it's an abscess, you usually need antibiotics, or you might need to see a doctor to drain and release the contents of the cyst. And when you feel the cyst, it tends to be quite fluidy to touch, quite firm, but not irregular or not like a hard mass where you're worried that could this be cancer. So a boil and a cyst, both of them tender, red, swollen, warm to touch. Boil tends to self-resolve, while a cyst in a lot of cases either stays the same or in some cases can form an abscess. Now, speaking about abscess, some women have what we call recurring lumps, where basically they have cysts that tend to form all the time, whether it's due to autoimmune reasons or they keep having blocked sebaceous glands. There's a condition called Hidradenitis Suppurativa, and these are chronic conditions where they tend to have flare-ups now and again. And with this sort of condition, Hidradenitis Suppurativa, you would usually need to go on long-term antibiotics. Some people actually need surgery, and you would notice that there is lots of scarring of the armpit, and some women actually have Hidradenitis Suppurativa in the groin regions as well. Another cause of lump in the armpit could be something like a lipoma. A lipoma is basically fatty tissue. Again, when you feel a lipoma, they tend to be quite mobile, a bit firm but soft to feel, and quite fluctuant. A lipoma can stay the same or it can get bigger, but they do not generally tend to be tender unless they're pressing on underlying structures such as nerves. And usually when your doctor feels a lipoma, it's usually quite obvious this is a lipoma, but if in doubt, you can always go and have an ultrasound done, and surgery is indicated if the lipoma is getting bigger, causing you discomfort or pressing on the nerves like I said. Now, the most common reason for lumps in the armpits tends to be swollen lymph nodes. Now, lymph nodes are usually pea-sized structures that you can find along your neck, behind your ears, behind your head, armpits, groin, and lower regions of the abdomen. Lymph nodes tend to be reactive in the sense that if you have an infection, your body is run down, the lymph nodes mount a response to support the immune system to fight that infection. So those lymph nodes become enlarged or swollen as a result. So you might feel a pea-sized structure in your armpit that's more enlarged if you've got an infection such as the boil itself, or you might have a fever or the flu and you might feel some lymph nodes in your armpits. Other infections such as tuberculosis, meningitis can cause swollen lymph nodes in your armpit. So that's something to be aware about. Swollen lymph nodes tend to resolve by themselves, usually by 3rd week or by the 5th or 6th week, the lymph node will start to go down to almost back to normal. Some lymph nodes can become infected and it's called lymphadenitis, and in those cases where the lymph node is infected, you might notice that the lymph node is becoming more tender as the weeks go by, it's becoming more enlarged, swollen, it's not getting better, you have other symptoms such as fever and night sweats. and in this scenario you need antibiotics. But speaking about fever and night sweats, we're now going to come on to the more serious reason why a lot of women are worried, and that is cancer. Now, with lump in the armpits, there is a condition called lymphoma. Lymphoma is a type of blood cancer where you can present with fever, night sweats, loss of appetite, weight loss, and lump in the armpit. With lymphoma, you can get lymph nodes in other parts of the body, but we are talking specifically about the armpit. So if you have a lymph node that you feel has not resolved in that 6-week time frame or earlier, if you have any of the systemic symptoms that I mentioned, such as the fever, night sweats, weight loss and loss of appetite, I'll be recommending you see a doctor for checkup, because usually this means you need further investigation such as a blood test, ultrasound scans. If the lymph node is suspicious, then your doctor will usually arrange for you to have a biopsy of the lymph node to have it checked to see if there's any cancer cells in the lymph node. Now, you can have swollen lymph nodes due to other cancers such as skin cancers and more commonly breast cancer. As you're aware, your breast is right quite close to your armpit. The lymph node usually tends to drain anything here in your breast right down to the axillary region as well. So a lymph node in your armpit could be a clue that you have breast cancer, and this is why women should always check their breast on a regular basis. Check your breast at least once a month. So if you notice that you've got a lump in your armpit, do not just be restricted to examine your armpit. You should also examine your breast for any suspicious lumps that you may not have identified. So if you notice that the mass in your armpit, which might be a lymph node or might not be a lymph node, is getting bigger, it's rock hard, it feels more like a marble than a pea-sized lump, then that's something that you need to be speaking to your doctor about, because with your breast tissue is not restricted here, the tail of your breast tissue actually extends to the armpit, which means that any cancer here can also spread to your armpit region as well. So this is why it's important to do breast examinations all the time. Now the question is, doctor, I've got an infection which is a boil or a painful cyst, how do I treat it? Now you can start with home remedies such as cold compress, which you can do 10 to 15 minutes, at least 3 to 4 times a day. What the cold compress will do, it helps to reduce the swelling, it also helps to numb the pain. If you wish to, you can also alternate with warm compresses as well. The warm compress increases blood flow to the area that allows for healing, and you can also buy over-the-counter remedies such as magnesium sulfate paste. Magnesium sulfate paste is like a poultice effect where it helps to kill the germs and draw out the infection. You can apply that as many times a day as you wish to, as well as doing salt water baths. Some people find Epsom salt, in a warm water bath, lie there for like 20 minutes. Do this at least once a day for the next 7 days, and that can help with any infection or boil in the armpits. Now, if despite these remedies you find that the infection is getting more painful, it's getting bigger, more red, more warm to touch, you might need systemic antibiotics, which you need to go to your GP for to give you the correct antibiotics for your infection. As I mentioned earlier, there are other conditions that can cause recurring boils in the armpit, and one good example is the Hidradenitis Suppurativa, and most women tend to take long-term antibiotics in that scenario. Other causes of lumps in the armpits, which I have not gone into much detail, would be, for example, if you tend to shave that area quite a lot. So some women can have what we call folliculitis, which is inflammation of the follicles, and that's due to excess shaving, and that can cause lumps in the armpit. That's again something that can be treated with. Do not shave for the next few days. Let the skin of the armpit heal. Use some antiseptic cream or gels to soothe the armpit area, and then see your doctor if there are any further concerns. So I hope you've enjoyed this video about lumps in the armpit. If you have any questions or comments, please drop them below.